I'm Cathy Elliott and I am Chair of NHS West Yorkshire, Integrated Care Board, the ICB, and Deputy Chair of our Health and Care Partnership. And Happy New Year to you. Welcome to 2024. I hope you're well and I hope you had time to rest and relax over the holiday period with friends and family and you're feeling refreshed and ready for this new year. I first of all want to thank you for everything you did last year. Thank you for 2023. There's so much we achieved together across the breadth and depth of our health and care partnership across our 5 places in Bradford District and Craven, Calderdale, Kirklees, Leeds and Wakefield. Thank you so much across acute, mental health, community services, in local authorities, voluntary and community sector and the NHS. We really appreciated everything you did. And we all collectively have a commitment to delivering quality and safe services for our residents in West Yorkshire, and also that continuous improvement and transformation in services for the better. So thank you. And I had the opportunity last year to get out and about and to meet services and talk to staff about the ways in which they're working to deliver the best possible care as close to home as possible. And that especially included going out to visit our hospital sites and hearing about their capital planning work. It also gave me the opportunity to go and visit places to hear about service improvement work, such as in Bradford, meeting young people to find out how they are having their say in improving mental health services, and hearing from local staff on how they're working to integrate and connect better those services for local young people. There's so much that went on last year, as you know, and in March last year, we especially celebrated the voluntary community and social enterprise sector, and also looked ahead to making sure that we're contributing to the sector's sustainability. And that work continues into this year through the Power of Communities programme, and also making sure that we're working across places and services to ensure that contracting and support continues. So as we come into this year, there is so much that we have to do and so much we want to achieve together. And we have our NHS Joint Forward Plan, and that's a plan that looks over the next 12 months or so, that complements and works with our overall strategic plan of 10 big ambitions over the next 3 to 5 years. And the two plans complement each other, and that particularly looks at early diagnosis for cancer, our continuation of suicide prevention campaigns and work, the ways in which we want to continuously improve maternity services, and also our support to people with mental health conditions and people with learning disability and autism, particularly to ensure that we're working to increase their life expectancy. And there's so much else as well that we want to achieve together this year. And across our partnership, we want to continue to make sure our health and care leadership is representative of the communities we serve. And so many people take part in that, and a number of campaigns, including our Root Out Racism campaign and our work with our Race Equality Network and West Yorkshire Inclusivity Champion. And we will also continue to work with a number of partners that we did last year, and that includes West Yorkshire Combined Authority. One thing I wanted to remind you of is West Yorkshire Voice, a forum for local people to share their thoughts. I find it incredibly helpful as NHS West Yorkshire Chair, talking to a forum of people who've come together through West Yorkshire Voice really brings lived experience into our decision making when we're looking at policy, commissioning and ways in which we want to deliver services in the future. So if you know of a patient forum, a community group, a resident association that wants to become involved, please let them know about West Yorkshire Voice. I'd really appreciate that. And as you know, in working with that kind of forum and Health Watch and many other patient and service user groups, these are ways in which we can embed citizens' voices in our decision making and our planning for the future, which is incredibly important. So it leaves me to thank you for all you've done and all you will do this year. It is greatly appreciated, and take good care. Thank you.